The country, of course, awaiting eagerly the arrival later today of the Oxford AstraZeneca vaccine, which is making its way from India, from Dubai here. More than 1 million healthcare workers will be vaccinated first. But some trade unions are questioning the delay in the vaccine rollout. My colleague, that's eNCA reporter Manqoba Mchunu, is in Spruitview this morning. That's in Ekurhuleni, and is joining us now. Manqoba, good morning. You've been up and about this morning, just chatting to a number of people, but particularly those who are in the front line, to find out, for example, are they excited? Are they having concerns? Are they ready to receive the first jab of the much-awaited vaccines? And what are the issues on the ground, Manqoba?
Well, certainly, Padan, a lot of optimism from the healthcare workers. But, of course, with that optimism comes a great deal of anxiety for many of these healthcare workers. Many of them, of course, still confused and about this particular vaccine and the rollout of this vaccine. But there are also issues, Padan, around the efficacy of this particular vaccine, with some of these healthcare workers questioning whether or not it will work, and some also very skeptical about this particular vaccine. We've spoken to some healthcare workers earlier on from the different institutions, of course, who spoke to us on condition of anonymity, and some of them telling us that they actually don't trust this vaccine and that they don't want to actually take this particular vaccine, given the fact that government has not come on board in terms of trying to bring in the nurses as well as the healthcare workers as a whole on this particular vaccine and how it will be rolled out. So quite a number of concerns. Of course, there are those who are quite happy and looking forward to this vaccine, but I'm going to be joining one of them and speaking to one of those healthcare workers, of course, who's joining me also on condition of anonymity. Siswami, thank you for speaking to eNCA. Let's start here. Personally, are you excited that the vaccine is finally arriving in South Africa today?
I'm only excited because it's arriving for them, not for myself and anybody who doesn't want to have it, unfortunately.
And in terms of yourself, are you going to be taking this vaccine? I know that many of your colleagues are saying that they don't want this vaccine.
Personally, I'm not interested in having it.
And why are you not interested?
There's a lot of indiscrepancy around the vaccine. There's been times where healthcare workers were exposed, properly exposed to the virus, and quite frankly, the government has done absolutely nothing in trying to prevent the spread of the COVID. And as they always preach that prevention is better than cure, that simply could have been providing PPE on time. This is a second wave, and it's without PPE to begin with. And then we go back to the idea of healthcare workers not being involved with this whole rollout planning and everything around, everything that's got to do with the vaccine being rolled out in South Africa as a whole, and only us being involved to be used as guinea pigs. It honestly seems like we're just being used as guinea pigs, mainly because maybe we are more exposed to the virus. I'm not too sure what the idea is, but to me it comes across as that.
So are you saying that you don't actually trust this vaccine? I
don't trust it at all.
Okay. And in terms of, I mean, you work in a ward where you're exposed to people with COVID-19. Aren't you fearful perhaps that, you know, this might be detrimental to your own health, given the fact that this vaccine could well be the prevention that you need to stop the spread of COVID-19?
I possibly could be, but I think I'm at a point where I'd rather find myself waiting to see what happens with those who are interested in having the vaccine, those who are willing to take the vaccine, see what happens with them. If there's any changes with their health going forward after they receive the vaccine, then maybe I can make a different decision. But at this point, while I stand as a guinea pig, I stand at not having it at all. I'd rather take my chances with contracting COVID and fighting it.
Okay. I hear that many people are also concerned about the issue of the side effects of this vaccine. Is this something that you're hearing from some of your peers and colleagues?
Yeah, I mean, we haven't really had that much about the side effects. There isn't clarity on the side effects, meaning there hasn't been much research done about on the vaccine specifically. They say they do have much research. I haven't seen much articles going on about it, what to expect going forward. The most common side effects, as we would normally see from our medication, we have leaflets that go on that have most common side effects and the least common side effects. And we're not seeing any of that going on around. And that alone is is very worrisome. It makes me worry. Like, where do we stand with this whole vaccine thing? Where does it put us as healthcare workers? Why does it even have to be us who have to start with it? We have cabinets who are at home. They're not going to work and they're not reporting on duty because they themselves are scared of COVID. Why does it not start there? Why don't they start and show the nation that this is something that can be trusted? If they trust it so much, can it not be something they receive first and then bring it over to the rest of the nation? Not just give it to the nation and then later them. And one could argue that the president is about to get the very first one of the vaccines today, but one person out of how many? What exactly will they be giving them? How sure are we that they'll be giving him the actual vaccine and, you know, not making up whatever it is that they would have made up to give to him? So it's really uncomfortable. Okay,
but from your other colleagues, what are you hearing? Are many of your colleagues saying that they're also not willing to take this vaccine, or is it a divided sort of a feeling among some of your peers?
It's a divided feeling. Some are excited about it. Some are very willing to take the vaccine. Some are willing to take one for the team, definitely. But there's quite a lot of us who are really not interested. We're actually waiting for those who are willing to take it for the team. So we see from them how they react to it, and we take it from there.
Okay, thank you very much.
Thank you.
Well, that was one of the healthcare workers in one of the hospitals here in Gauteng, speaking to us, of course, saying that she herself is not willing to take that vaccine. And of course, these are some of the sentiments that we've been hearing from some of the healthcare workers this morning. And obviously, some of them saying that they're willing to take their chances with the vaccine, given the fact that they're the front line in dealing with COVID-19. So certainly a mixed feeling from healthcare workers, Patel.
Yeah, it looks like there's still more work that needs to be done by the health department and other government officials in really educating all of us about the benefits of the vaccine and, of course, side effects, so we make very conscious, informed decisions. Thank you very much, Manqoba Mchunu, as we continue, of course.